Welcome to evergreenmd.org. I'm Matt Jablow, and this is the Evergreen Health Outlook. Joining me now for our very first Health Outlook is Dr. Peter Beilenson, the founder and chief executive officer of the Evergreen Health Co-op. Dr. Beilenson, I think the best place to start is, what is the Evergreen Health Co-op and how did it get started?
Well, we hatched out a lot of the details at the Evergreen Cafe in Baltimore, and that's how we got our name. But we come from a portion of the Affordable Care Act, also known as Obamacare, which a section of which allowed for the formation of nonprofit health insurance companies in each state. And they're also a cooperative, so they're owned and governed by their members. And we are one of 24 around the country in 23 different states.
You've spent your entire life in public service, in public health. Why decide to start up a healthcare or health insurance organization?
For 20 years of working in public health, probably the single most important issue that I worked on is access to care for the uninsured in Maryland. And the Affordable Care Act, through its different components, and specifically through the Health Co-op, allows for increasing access to a significant number of Marylanders, and that's why we started the Health Cooperative. And the key here is to make sure that vulnerable populations in Maryland are not treated in a two-tier system where if you have health coverage through your employer, you get great health care, and otherwise you get terrible health care. We want to make sure that our members have high quality, affordable health care for their entire family.
As we all know, consumers have a lot of choices now in Maryland for health insurance and health care. Why should they choose Evergreen?
Well, first of all, we're very competitively priced with the big guys. Secondly, it's actually a cooperative, so it's owned and governed by the members, and any profits that we make, being a nonprofit, any profits that we make go back to the benefits of our members, whether through rebates or through wellness programs or whatever. But most importantly is the quality of care that they're going to get. They'll get much more personalized care than in the traditional system, with much more time with their health care providers, their doctors, their nurses, because our docs have much smaller patient panels. They're taking care of many fewer people per day, and therefore they'll have more time to spend with their patients, the members. In addition, at our patient-centered medical homes, we don't just have doctors and nurse practitioners, we also have health coaches to help you with wellness plans that you want to work on. We have social workers to deal with mental health or substance abuse issues if you have them on site. And we have care coordinators who will make sure that referrals are being done in an appropriate manner. The reason we can do this is we've gotten away from the fee-for-service system. Fee-for-service, where you get paid for every different thing that you do, every procedure, every test, every lab slip that you put in, is a perverse incentive to do more for unnecessary reasons. And that drives up the cost, and it also encourages doctors and nurses to see a lot of patients quickly to generate these fee-for-service. We pay our doctors a very reasonable salary, a very competitive salary, so that they're spending their time working on your healthcare needs and your wellness needs, not on the finances.
Dr. Beilenson, thanks for joining us for our very first Evergreen Health Outlook, and thank you for watching. We plan on posting health outlooks to our website on a regular basis on all kinds of topics involving the worlds of healthcare and health insurance. If you have any suggestions about things you'd like to hear about or learn about, send me an email at mjj@evergreenmd.org.